Good day, everyone. I'm excited to talk about a topic that affects nearly every one of us in some way: cholesterol. You've likely heard the term before, often in connection with heart disease, but what exactly is cholesterol? What are its risks to CVD? And what are its treatments? These are the key questions I want to address today. To begin with, cholesterol is a type of fat, also known as a lipid, that is essential for many functions in our body. It's a waxy, fat-like substance found in every cell. Your body uses cholesterol to produce important substances such as hormones, vitamin D, and bile acids that help you digest fat. In fact, about 80% of the cholesterol in your body is made by your liver, while the remaining 20% comes from the foods you eat, particularly animal-based foods like meat, eggs, and dairy products. While cholesterol is necessary for good health, the problem arises when there's too much of it in the blood, especially in the form of low-density lipoprotein, often referred to as bad cholesterol. But I'm getting ahead of myself, so let's break this down further. Cholesterol isn't just one single substance in the blood. It exists in different forms, primarily low-density lipoprotein. LDL is often referred to as bad cholesterol because high levels of it in the bloodstream can lead to the formation of plaques on the walls of your arteries. These plaques are made up of cholesterol, fatty substances, and other cellular debris, and they can cause the arteries to narrow and harden, a condition known as atherosclerosis. Here's how LDL contributes to artery problems. LDL molecules in the bloodstream can penetrate the inner walls of the arteries. Once inside the artery walls, LDL can become oxidized. Oxidized LDL is particularly harmful because it triggers an immune response in the body. The immune system sends white blood cells called macrophages to engulf the oxidized LDL, but these cells can become overwhelmed and deposit cholesterol, contributing to plaque buildup. Over time, the buildup of fatty deposits can form hard plaques that narrow the arteries and restrict blood flow. This increases the risk of heart disease, stroke, and other cardiovascular issues. High-density lipoprotein, HDL, on the other hand, is known as good cholesterol because it works to remove excess cholesterol from the bloodstream and the walls of the arteries. This helps to prevent the harmful buildup of cholesterol and plaques. Here's how HDL works to protect the arteries. HDL picks up excess cholesterol from the walls of the arteries and other tissues in the body. This process is called reverse cholesterol transport. Once HDL has picked up the cholesterol, it carries it back to the liver, where it can be processed and either excreted in bile or converted into other substances the body needs. Anti-inflammatory and antioxidant properties. HDL also has anti-inflammatory and antioxidant properties, which help to reduce the inflammation and oxidation caused by LDL, further protecting the arteries from damage. The connection between diet, exercise, and cholesterol is a crucial one when it comes to reducing the risk of cardiovascular disease. Now I will talk about how diet affects cholesterol levels. Limit saturated fats. Saturated fats are found in foods like red meat, butter, cheese, and other full-fat dairy products. They raise LDL cholesterol levels in the blood. Cutting back on these fats can lower LDL levels. Good alternatives are to go for healthier fats such as those found in olive oil, avocados, nuts, and seeds. Avoid trans fats. Trans fats, found in partially hydrogenated oils, processed snacks, and many baked goods, not only raise LDL cholesterol but also lower HDL cholesterol, which is harmful for heart health. Tip: check ingredient labels for partially hydrogenated oils to avoid these fats. Increase soluble fiber. Soluble fiber binds with cholesterol in the digestive system and helps remove it from the body. Foods rich in soluble fiber include oats, barley, beans, lentils, fruits, and vegetables. Benefit: increased fiber intake can lower LDL cholesterol by up to 10%. Eat more plant sterols and stanols. Plant sterols and stanols, found in fortified foods such as margarine and certain fruit juices, can block cholesterol absorption in the intestines. Effect: they can reduce LDL cholesterol by 5–15%. Focus on omega-3 fatty acids. Omega-3 fatty acids, found in fatty fish like salmon, mackerel, and sardines, have been shown to reduce triglycerides and improve heart health. While they don't directly lower LDL cholesterol, they help reduce the risk of heart disease by improving overall lipid profiles. Omega-3s can lower triglyceride levels by 20–50%. Healthy fats. Unsaturated fats, especially those in olive oil, nuts, seeds, and fatty fish, can raise HDL cholesterol. These fats help to increase the transport of cholesterol away from the arteries and back to the liver, where it's processed and eliminated. The more unsaturated fats you consume, the more HDL cholesterol you can produce. Monounsaturated fats and polyunsaturated fats. These fats, which are found in foods like olive oil, canola oil, avocado, and certain fish, have been shown to increase HDL cholesterol and improve overall heart health. Moderate alcohol consumption. Moderate alcohol intake, particularly red wine, has been shown to raise HDL cholesterol. However, it's important to note that excessive alcohol can have harmful effects on the liver, blood pressure, and overall health. 1 drink per day for women and up to 2 drinks per day for men may help increase HDL. Now I will talk about how exercise affects cholesterol levels. Regular physical activity has a powerful impact on cholesterol levels and heart health. Here's how. Increased physical activity reduces LDL. Engaging in regular exercise helps lower LDL cholesterol by improving the efficiency of lipid metabolism in the liver, where cholesterol is processed. Moderate intensity exercise like brisk walking, cycling, or swimming for at least 30 minutes most days of the week can significantly reduce LDL cholesterol. Improved lipid metabolism. Regular exercise increases the body's ability to break down and eliminate excess cholesterol, particularly LDL. Exercise also promotes the activity of lipoprotein lipase, an enzyme that helps process fats in the bloodstream. Aerobic exercise increases HDL. One of the most significant benefits of regular exercise is its ability to raise HDL cholesterol. Aerobic activities, such as running, cycling, or swimming, increase the size of HDL particles, which are more effective at removing LDL cholesterol from the bloodstream. Regular moderate to vigorous physical activity increases HDL levels by as much as 5–15%. Stronger cardiovascular health. Regular exercise strengthens the heart and blood vessels, improving overall cardiovascular function and reducing the risk of heart disease. It helps maintain a healthy weight and reduces other CVD risk factors, such as high blood pressure and diabetes. Statins are a class of medications commonly prescribed to lower cholesterol levels, especially low-density lipoprotein, often referred to as bad cholesterol. Statins are among the most widely prescribed medications worldwide because of their proven ability to reduce the risk of cardiovascular disease, including heart attacks, strokes, and heart failure. To understand how statins work, let's break down their mechanism of action, their effects on cholesterol, and how this leads to a reduced risk of cardiovascular disease. Statins work by inhibiting an enzyme in the liver called HMG-CoA reductase, which is responsible for the production of cholesterol. This enzyme plays a crucial role in the synthesis of mevalonate, a precursor molecule needed to make cholesterol. Statins block the HMG-CoA reductase enzyme. By inhibiting this enzyme, statins reduce the liver's ability to produce cholesterol. The liver, in response, perceives lower cholesterol levels and compensates by increasing the number of LDL receptors on liver cells. They increase LDL receptors. The increase in LDL receptors means that the liver can more efficiently remove LDL cholesterol from the blood. As a result, the overall amount of LDL cholesterol circulating in the bloodstream decreases. By lowering the production of cholesterol and increasing the liver's ability to clear LDL cholesterol from the bloodstream, statins significantly lower LDL cholesterol levels. Typically, statins can lower LDL cholesterol by 20–60%, depending on the dose and the specific statin used. This reduction in LDL cholesterol is a key factor in reducing the buildup of plaque in the arteries, which can narrow blood vessels and increase the risk of heart attacks, strokes, and other cardiovascular problems. Lowering LDL reduces plaque buildup. By lowering LDL cholesterol, statins help slow down or prevent the formation of atherosclerotic plaques in the arteries. These plaques are made up of cholesterol, fats, and other substances that accumulate in the walls of arteries. As plaques grow, they can restrict blood flow and make the arteries less flexible, leading to atherosclerosis. Statins also help stabilize plaques that are already present in the arteries. Unstable plaques are more likely to rupture, which can trigger the formation of blood clots. If a blood clot blocks a coronary artery, it can lead to a heart attack or stroke. Statins reduce inflammation and help seal these plaques, making them less likely to rupture. Cholesterol lowering is not the only way statins benefit heart health. Statins also have anti-inflammatory properties, which are important because inflammation is a key driver of atherosclerosis. By reducing inflammation in the blood vessels and arteries, statins can reduce the risk of plaque rupture, which can lead to heart attacks and strokes. Reduction of inflammatory markers. Statins lower levels of inflammatory substances like C-reactive protein, a marker associated with higher cardiovascular risk. Lowering CRP levels contributes to a reduced risk of cardiovascular events. While the primary effect of statins is to lower LDL cholesterol, they can also have modest benefits on other aspects of lipid profiles. Statins can reduce triglyceride levels, which are another type of fat found in the blood that can contribute to cardiovascular disease when elevated. Statins can also slightly increase HDL cholesterol, which helps remove LDL cholesterol from the bloodstream and protects against the buildup of plaque in the arteries. While statins are not the most potent way to raise HDL cholesterol, the modest increase in HDL further enhances their cardiovascular benefits. Statins are especially effective in reducing the risk of heart attacks and strokes for individuals who are at high risk for cardiovascular disease. This includes people with existing cardiovascular disease. For individuals who have already had a heart attack, stroke, or other cardiovascular events, statins can reduce the risk of further events by lowering cholesterol and stabilizing plaques. Risk factors for CVD. Statins are also used in individuals who have risk factors like high blood pressure, diabetes, smoking, or a family history of heart disease, even if they haven't had a cardiovascular event yet. Statins reduce the risk of both heart attack and stroke. They lower the likelihood of an event by reducing the chance of plaque rupture, improving blood flow by stabilizing blood vessel walls and reducing inflammation, by lowering LDL cholesterol and improving overall heart health. Statins can significantly decrease the mortality rate from heart disease and related conditions. Studies have shown that statins can reduce the risk of death from coronary artery disease by about 20–30%. While statins are generally safe and effective, they do come with some potential side effects, which is why they should always be used under the guidance of a healthcare provider. Common side effects include muscle pain or weakness, liver enzyme abnormalities, increased blood sugar levels, digestive issues. However, the cardiovascular benefits of statins typically outweigh these risks for individuals at high risk of heart disease. Your doctor will monitor you regularly to ensure the medication is working effectively and adjust the dose if necessary. Thank you for listening. There is no need for you to ever question anything about cholesterol's risk to CVD and its main treatments. Bye bye.